Like and subscribe and click the bell icon to get new video updates.
Vaping causes harm and addiction in new generation of users. Major report warns the growing use of e-cigarettes, or vaping, in Australia poses a serious public health risk, and threatens to introduce a new generation to smoking. That is according to the authors of a major new government report into the health effects of e-cigarettes, which found vaping can be harmful, particularly for non-smokers and young people. The global systematic review, undertaken by researchers at the Australian National University, is the most comprehensive review of vaping-related health impacts to date. We reviewed the global evidence in order to support informed choices on vaping for Australia, said review lead author Emily Banks from the Australian National University's National Centre for Epidemiology and Population Health. The evidence shows e-cigarettes carry significant harms. The review found vaping increases the risk of multiple adverse health outcomes, including poisoning, addiction, seizures, burns, lung injury and smoking uptake. Professor Banks said the high and increasing rate of vaping among young people was causing addiction in a new generation of users. Nicotine is a key ingredient and one of the most addictive substances known, she said. Young non-smokers who vape are around 3 times as likely to take up smoking than non-vapers. Indiana, Australia, it is illegal for anyone to possess a nicotine-filled vape unless they are over 18 and have a prescription to help them stop smoking. But in recent years, medical experts and educators have expressed concern about young people continuing to access disposable vape products, often containing nicotine, at convenience stores and other retailers. E-cigarette use is more common among youth, particularly young males, and the majority is not for the purposes of smoking cessation, Professor Banks said. Vaping on the rise despite health concerns. E-cigarette use has increased steadily in Australia in recent years. Data from the 2019 National Drug Strategy Household Survey showed 11% of people aged 14 and over, roughly 2.4 million Australians, had used e-cigarettes at least once, and 2% of people reported current use. Among people aged 18 to 24, that figure was 5%. More recent data from the Australian Bureau of Statistics showed 1 in 5 people aged 18 to 24 had tried vaping. Professor Banks said high-concentration nicotine products were being targeted at young people with fruity, confectionary flavourings and discrete packaging. Young people are being sold a lie that e-cigarettes are just harmless water vapour, she said. They are not harmless water vapour. They contain a lot of chemicals and there is evidence that they are harmful to health. You don't know what it is doing to you. Brisbane woman Alison Bolton knows firsthand just how crippling a smoking-related disease can be. She was diagnosed with lung cancer 5 years ago and needs medication daily to keep the advanced cancer from spreading. So she was shocked to discover her 15-year-old son had started experimenting with vaping. We found a vape at home. I can see it from his point of view. It is so normalised, accessible, and everyone is doing it, Ms Bolton said. She doesn't want to see other young people needlessly go down the same path as her. She worries that, much like smoking in her youth, the full health implications of vaping remain unknown. You don't know what is in vapes for a start, she said. You don't know what it is doing to you. Evidence of lung injury and uncertainty about the long term. The new report found conclusive evidence that e-cigarettes can cause acute lung injury, predominantly in cases where people use vapes containing the psychoactive substance THC and vitamin E acetate, but not always. In February, the autopsy of a Queensland man showed he died of a severe lung injury that was probably caused by vaping. Read more. Similarly, a 15-year-old Sydney girl ended up in intensive care last year with what doctors believe was e-cigarette or vaping-related lung injury, also known as EVALI. But one of the biggest concerns outlined in the report was how little is known about the potential impacts of e-cigarettes on most major health outcomes. We don't know, for example, what e-cigarettes do to cancer risk, Professor Banks said. We don't know what they do to cardiovascular disease, We don't know what they do to reproductive health, and we don't know what they do to mental illness. That means the safety for those things has not been established. Vaping to help quit smoking. While vaping is sometimes promoted as a way to quit smoking, the report found there was only limited evidence that nicotine e-cigarettes were effective in helping people to quit. Most people who quit smoking successfully do so unaided, Professor Banks said. E-cigarettes are likely to be harmful for